Ngā mihi nui ki a koutou katoa, ko Waitenei, ko PaulaToko King, Paku Ingoa, no Te Aupauri, no Te Rarawa, no Ngā Pui, no Ngāti Whātua, no Waikato Tainui, no Ngāti Maniapoto hau. No reira, tēnā koutou katoa. Kia ora, I'm Paula. I'm a public health physician and a research associate professor working at the Kaupapa Māori Māori Health Research Centre in the University of Otago in Te Whanganui, Otara.
Kia ora koutou, ko Ruth Cunningham tōku ingoa, ko Ngāti Pakeha te iwi, ko tangata tiriti au. I'm another public health physician working at University of Otago in Wellington, and excited to be presenting this work that Paula and I have been doing together.
So what we're talking about today is our TIAKI project. So TIAKI means to care, and the focus is on community wellbeing for whānau with lived experience of prison. So there's a few things that we'll sort of be talking about today.
Yeah.
It's funded by the Health Research Council, and we're in our last year of this project. So just sort of thinking about the background, and Professor Tracy McIntosh, who is based in Auckland University, she's very well known in the space around the impacts of prison on Māori. And she talks about the warehousing of surplus humanity in prisons as a crisis that has resulted in an unjust society where the shadow of the prison colonizes our landscapes. For far too many people, especially our children, it colonizes their future. And I wanted to share this quote because it really kind of provides the context to why we're doing this work. But it also kind of provides a bit more of a context around how we theorize about the data pertaining to this work.
So this is a public health issue. Incarceration is a public health issue, and I think that was reinforced in COVID. And this statement from the American Public Health Association really recognises that the carceral system is a public health problem that we need to essentially do away with, and talks about moving towards abolition of carceral systems as something that's important to advance public health. And so this research comes from that perspective, but wants to understand how we can properly support and whakamana those who have been experienced the carceral system within the context of moving towards abolition.
In terms of the context of this statement in 2020, so this kind of came off the backs of the COVID pandemic and kind of the sort of inequities and the deaths that were occurring for people in prison, and also for people who worked in prisons, and also for the families of people who were working in prisons in the States, and also for the communities that the people who were staff members were going back into. So there was a whole massive thing about the inequities being sort of right in everyone's faces, and then kind of a review of kind of all the evidence around do prisons work or not, and the evidence base says that they don't work. But the American Public Health Association really kind of took some leadership in this area with regards to putting out the statement that actually a way forward with managing the COVID pandemic is stop putting people in cages where they're basically like it's a massive vector for the disease, and start decarcerating. So that's actually what there was a whole kind of movement in that area. So I think that that's where that statement came from, but it's really useful to fall back on because there was like a follow-up from that. Like there was a move to decarcerate. The problem is that especially in New Zealand, we're pretty behind really in this space compared to overseas, and especially for Indigenous peoples when we think about who's mostly put in prison in Aotearoa, it's mostly Māori, over 50%. in the prison population. And though we'll actually talk about that because it's a bit of an undercount, so we'll kind of talk to the data which shows that as well. Yeah, so that's kind of what we're kind of focusing on. Now, why are we in this space? There's actually like a whole collective of Māori working in the space of decarceration or prison abolition. So we're part of a collective. The focus that we have is mainly on community re-entry because that's an area that's really underserved around prison and health and wellbeing for not just Indigenous populations, for a number of people globally. And so we're kind of, our focus is obviously prison as a determinant of health and wellbeing, but at the end of the day, we're kind of focusing very much, and if we want to decarcerate from prisons, we need to make sure that there's a whole lot of people in there that need support and help to come out as well and to be healthy and well, when we know that there's a whole lot of underlying health issues and morbidity related comorbidities related to who ends up being in prison in the first place. So that's really our positioning, where we're kind of trying to be part of a collective approach. And that kind of leads into the actual project. So I said it was funded by the HRC. This is one project of a couple that we're doing. So this is focusing on re-entry wellbeing for whānau who come out of prison into the community, but it's focusing on Māori adults. And we have another project that we're working on as well, called Tāwhiri, which is related to tamariki and rangatahi Māori, between the age of 10 to 24 coming in relation to youth justice residences and coming out of prisons as well and wellbeing. So this, we're just going to talk about the TIAKI one because we're a little bit more ahead of in this one. And it's led by myself and Ruth and Cheryl Davies, who is works at Tūkotahi, which is sort of part of Kōkiri Marae, so one of our key partners that we work with in terms of Kaupapa Māori organisations in the rohe that we're based in. And we have Māori research team members and project advisors, including Māori with lived experience of prison. So there's two aspects to it. We're using routinely collected government data to understand community re-entry pathways for adult Māori and factors influencing their wellbeing outcomes after release, but it's also about resourcing Māori who have lived experience of prison to be their own researchers and to develop strategies for self-determined pathways supporting positive community re-entry wellbeing. So this is a mixed methods project. So we've got the quantitative component, which I think is the first thing on the list, and then a qualitative component. So we have whānau who've been in prison. They're the ones who are actually doing all the qualitative research, and they've developed, been involved from the outset in both of the spaces in the quantitative and qualitative aspects of the project, but they've actually completely led the qualitative research, and they've just finished the data collection in terms of interviewing over 40 whānau who have lived experience of coming out of prison. And so we're sort of at that at the level of doing the thematic analysis now.
So as Paula says, we have, two parts to this project, but they're very much intertwined. And so we have the work that's happening in the IDI, and we have the work led by whānau with lived experience. And what we want to talk to you about today, we haven't got lots of results to share, although we're getting into the last year of the project where those are coming. But what we did want to talk about was the approach that we've been thinking about in terms of how we use this, the government data, the data that's in the IDI. How do we use particularly the Indigenous data, which has been collected in circumstances of coercion or coerced data. And when we think about it, there's quite a lot of government data that is coerced, but the data that's held by corrections is particularly coerced, and how do we work with that data in a way that respects and understands where it's come from and adequately reflects the lived experience that sits alongside or behind that data. So how do we centre lived experience within our work with that routine data in order to, I do believe it's important that we use that data. That data is there, and I think it's important to use it to shine a light on what's happening. And we don't have a lot of research in New Zealand, as Paula says, that takes a public health approach to the issue of incarceration. So I think it's really important that we are using it, but really important that we're thinking carefully about how we use it and that we're centering lived experience in our exploration of that data. And so that's kind of what we want to primarily talk to you about today.
And the other thing as well is just thinking about the kind of contextualization of data relations and practices for Indigenous peoples, and Māori and other Indigenous peoples have a long history of being classified and measured and monitored as part of colonial projects, and quite often Professor Maggie Walter always talks about the 5Ds, thinking about how that data is framed in terms of disparity, deprivation, disadvantage, dysfunction, and difference. But at the same time, from a Māori data sovereignty context, Māori have the rights to utilise data to hold the government to account. So we're kind of coming from that position. But in saying that, we are very aware that the specific data that we're working with is very much non-consented data. I don't think that this is necessarily confined to the corrections and police and justice data sets. I would say that it also has implications for mental health data when you think about data that's collected for people who've been sectioned under the Mental Health Act. So we think about the seclusion data or community orders, etc. So I think what we're doing has broader applicability than, say, just the data that we're looking at with regards to experiences of prison. It's actually experiences in health care and disability care services as well. So we're just going to talk about how we've thought about developing a Tikanga Māori data sovereignty framework. Now, I just was thinking back to the first quote about warehousing our humanity that Tracy McIntosh has kind of spoken about. She speaks about it quite often. But I also think, that when we think about, theorize about the data that we're using, I do think about how we're looking at data that's been warehoused, and you have a lot of warehousing of data that holds knowledge about our humanity, but yet the way it's used quite often by the state, but also by other actors, in terms of the way it's framed or collected, framed, managed, etc., extracted, a lot of those ways dehumanizes us. When I say us, I'm talking about Indigenous peoples, but there's also other groups that this happens with as well, not just Indigenous peoples. So that's kind of what we're thinking moving forward. In terms of how we address the issues that we've raised with regards to the use of this data, we decided to go back to our tikanga values and principles. And so we're kind of focusing on, okay, well, what's our context at the moment in terms of where we're working from with regards to even the lands and the vicinity that we're in. And so we've gone to use the manu tohu, which is one of it's tū kotahi. It's actually the Tākiri Mai Whānau collective tohu, which highlights all of the values that underpin their practices with regards to tū kotahi and kokiri marae and their other partners in their whānau ora collective. So you'll see there's whānau, rangatiratanga, te reo, whanaunatanga, a whole number of really important values. And then we also have gone to the Māori data sovereignty principles that were developed by Te Mana Raraunga in 2018. I think these should be pretty well known by now. And so they cover rangatiratanga, whakapapa, whanaunatanga, kotahitanga, manakitanga, kaitiakitanga. For us, we have kind of looked at it from the perspective of two things. So these are the values that we've ended up with, which I've slightly color-coded a little bit. But what we were trying to do is think, okay, what do these values mean? Where is there crossover between the values and the place, the rohi, the area that we're kind of situated within in terms of working on this project, and in terms of our key partners that we're working with in terms of Te Kotahi and Kokiri Marae. What do these values mean in the context of the TIAKI project in terms of like the lived experiential realities of the whānau that we will engage with as part of this project in terms of study participants or in terms of the kairangahau, the researchers with lived experience, etc. So we went through a big exercise, which has happened over a couple of years, like lots and lots of wānanga with our broader team of lived experience and everyone involved. And we have kind of thought through what does this mean for within the context of the TIAKI project. And then we've also thought about what does this mean in the context of how we apply it to our process around data collection, analysis and framing. So we've come up with these principles. There's a crossover already you can see with the Māori data sovereignty principles and what was in the manu tohu. Then those green ones, mana whānau, tūranga waiwai wairua, those the values that have come from the tohu that haven't come from the Māori data sovereignty principles. And then we've actually got a new one as well that we developed as part of that we thought was really important based on all the wānanga and kōrero that was had, te wā, which is about time. So whanaungatanga as an example, and when I say interpretation, we were thinking about what does this mean in the context of this project and the broader context within which imprisonment occurs in the background of coloniality and racism and all the rest. So whanaungatanga, from the perspective of this project, centralizes the importance of being in good relation to one another, having good relations with our surrounding environments and within our local and international contexts. It entails recognition and acknowledgement of the importance of positioning ourselves in relation to the data we utilize about whānau with lived experience of prison. And then application. So there's some things about what does whanaungatanga mean in terms of how we apply it to data, which is the quantitative and the qualitative data. So we understand that the collective benefit of the research is contingent upon its positive transformational potential for whānau. Why would we do this if it didn't have that potential, as opposed to just sort of being extractive and doing research for the sake of it or anything like that. And so we demonstrate our obligations and our accountabilities to whānau by ensuring that we produce relevant and meaningful outputs that contribute to wellbeing. Whānau deserve the very best. We honour our obligations through providing as holistic and accurate an understanding of the experiences of whānau as possible. This means addressing issues of poor ethnicity data quality in national administrative data sets, which we'll talk to a little bit later on. So I think you can start to see, when we're talking about the application, we're thinking about, okay, so how do we, what are the pathway, what are we actually focusing on prioritizing with regards to the data analysis? What are we focusing on in terms of how we frame it? Those sorts of things. And then we choose a method. So in this case, it's mixed methods to provide as comprehensive a perspective that situates multiple data sources, collections and analysis in relation to one another. And within the broader contextual knowledge is what is known about the experience of Indigenous peoples regarding the impacts of the colonial carceral state on wellbeing. For us, it's about the how we do the research is of equal importance to the findings. So that's one of the key things about this project that we've sort of really prioritized, is the way we do the work is of equal importance to what we find out with regards to answering the research questions and all of that. And as part of that, we're committed to making space for celebrating the achievements of the kairangahau who are involved in this. we work to ensure that our outputs are accessible for whānau and communities. What's the point of doing all of this work if it's not, the way we translate it isn't very good in terms of not resonating with communities and not being meaningful. So it means that we've got sort of a very broad dissemination strategy, which is over and above, just doing the usual articles and all that sort of thing, which have a role, but that's only one small part of it.
Just picking up on what Paula has been saying, for me as someone who's coming in, bringing some knowledge around the IDI and the linked data and its possibilities, it has been really important to be walking beside our lived experience researchers at each point, so that coming in and making sure that people have a good understanding about what this data is and where it's coming from and why we're using it, and having those conversations, and then starting to look at it together, and to have that journey together with the data, which is really part of that whanaungatanga. How we embody those values, I think, is really what we're interested in figuring out in this process. And so, as Paula says, the value that we really felt was important in coming out of our conversations with the kairangahau and as a whole group, was that time was really important, that te wā was really important. And what do we mean by that? We mean recognising Māori constructs of time, and that's central to the ways that we do things and to the ways that we generate knowledge, and acknowledging time, the time that the whānau with lived experience have, the journeys that they've come on, the different aspects of their time, and the time that it takes to establish connections and reconnections. So recognising and honouring their time and where they're at, but also honouring the time that they're contributing to TIAKI as being a really important part of what we are doing. And it's been a journey of figuring out how to honour that time, and the best way to honour the time of our kairangahau and the time of the participants in terms of what is the most useful and meaningful way to do that. And that's been working with tukotahi around their experience and what people find useful. So how have we applied those ideas? So as it says, rather than being tied, and we are a bit tied, and we always are a bit tied to the colonial capitalist timelines of the funders and all those things, but actually making the time to honour the time needed to reach our goals, and really focusing on the process as much as we can, and that's equally as important as the outcome. We've been talking about time in the data collection, and which means what period of time are we looking over? How are we thinking about the time that someone has been incarcerated prior to release? Is it important to look separately at people who've been in prison for a long time versus those who haven't? And the answer from our kairangahau is no. From their lived experience, recognising that people are actually coming in and out of prison, and actually, so it's not about all of that experience of incarceration is a harm, and we need to kind of understand and honour that. So I think those conversations around time have really informed the way we've approached the research.
So when we talk about honouring the time required, it meant we sort of front-loaded the project with as much time as what was required to be able to do things in a way that had integrity and were the right ways to do things with this project. But that means that now we're sort of really, I don't think we would have achieved as much as what we have so far if we hadn't done that. So now we're actually kind of moving really fast, like a lot faster than, so we're sort of motoring along now. And so I think that was yeah, to kind of think about, we are in a kind of like there is a linear 3-year kind of thing with the HRC funding and all of that, which doesn't really work with with a lot of Kaupapa Māori projects realistically. But in this case, I think by actually saying, no, this is more what we're prioritizing, it's meant that we've actually managed to do a huge amount with this project that we wouldn't have been able to do if we just like followed a Gantt chart and ticked the box and all this about where we were at and all that. So yeah, and the other thing that we wanted to, the time is about recognizing that things aren't prescribed and anything is possible if we think about Māori constructs of time which are not linear, and that we can imagine different ways of being and things as well, and to support like a different future. And that might also require a leap of faith for a lot of people, not just ourselves, obviously, but yeah, like for society, for for government, for everyone really. But I think I suppose one of the main things is that with all the interviews of the whānau who wanted to be involved in this project in terms of being participating in the qualitative interviews and things like that, and it was through the networks of the kairangahau that we were able to, because that's quite a large cohort for qualitative interviews. You would not for a population of people that might not necessarily have wanted to engage in a project in research, because a lot of people are kind of suspicious of research, and I mean that's probably fair enough in terms of like the history of, especially for Māori. But I think the main, like for every single person or whānau who wanted to be involved, their main reason was to help others. So that was their key reason for wanting to share their story or share their knowledge or share their perspective, was they wanted to make things better for others. Yeah. So we need to be, we have hold our obligations to that in terms of how we follow through with the knowledge that's just been shared.
I guess just reflecting on that and the pushback that we had from the funder in terms of really wanting to support with people with lived experience to be the researchers and to do the interviewing.
For this area, it's an absolutely new approach. It hasn't been done overseas or anything like that. It's like these are sort of new areas, but we value the knowledge and expertise that lived experience brings, and that's valued in other spaces. So why would we not be valuing it in this space?
No, and it has been an incredibly amazing journey, I think, as a researcher to be a part of that, and as Paula says, we've it takes time, but we've really been able to find things out and to work in a way that's been great. So we recommend it. So now I'm just going to move from talking about the approach stuff to talking about some initial data quality work that we did. And so this is work identifying people who were in the corrections data, so who had been in prison. And we were interested in understanding, so corrections reports, how many Māori or what proportion are Māori in prison, and we were interested in understanding the nature of that data around ethnicity for which corrections we're reporting and which corrections have on their data set in the IDI. We're interested in understanding that data and comparing who was identified as Māori in that data versus in other sources of information within the IDI. And so, and you'll note, so the variables on here are the variables from the corrections data. So within the IDI, it's a preferred ethnicity reported, which is a single ethnicity for each person, and we have not been able to get a clear clear answer on the way in which preferred is identified. So that's the data that's available from corrections. And so cohort A, or our main cohort, was people who were identified in corrections as having, in that corrections data, as having been in prison. And then we wanted to compare to the information available in the personal details table. So what ethnicity did it say is the sort of best guess within the IDI of someone's ethnicity. And so in order to do that, we needed to identify people who were in that cohort and linked to the spine. And so 98% of people were. So we had our second cohort, cohort B, which was people who we could identify in the spine. And then we had a third cohort. We wanted to know about self-identified ethnicity. And so in order to do that, we looked at the 2018 census and found people who had self-identified ethnicity reported on the 2018 census. And so although we had 98% of the cohort linked to the spine, actually only 34%. Obviously within that 98, 34% had self-reported ethnicity data that we could then use to compare across. And you can see, if you look at that cohort C, that there were a lower proportion of Māori in that cohort. So fewer Māori who had so this is correction says that they're Māori, and fewer of those people had self-reported ethnicity than made up the whole cohort. So these are our three cohorts that we're then going to use to compare ethnicity information across. And so the first thing we did was to try and understand the proportion who were Māori, comparing what corrections said and what the IDI personal details data said. So in this, we didn't have any information that we knew was self-identified, although there'll be some within that personal details table one. But so what we wanted to do was understand that does it make a difference in the proportion who are Māori, whether we use that corrections data or whether we use data from the personal details table. And if you look at the bottom row there, you can see that, and that's commonly reported, around half of people in prisons are Māori, and so that's that 52%. But when we look at those same people, so it's taking that same group of people who've been identified as having been in prison, when we look at that group, looking at their personal details table ethnicity and who's identified as Māori on that data set, we find that actually 57%, so a much higher proportion, are identified as Māori when we use this better source of ethnicity data, recognising that the preferred source means that there's only one per person, but there's not a sense of, there's no sort of prioritisation process that we know about, so we can't understand what that means. Having only one ethnicity recorded means for Māori, but we know that if that data is being used and reported, and we know that it is, then that is undercounting Māori within corrections, or Māori who are in prison are undercounted. And we can see that it varies a little bit between men and women and by age, with the largest group of, or the undercounting most of a problem among young people. Yeah, and actually similar across remand in prison. And so, yeah, so first finding was that there is that undercounting, that the corrections data is undercounting Māori. And then the second thing we looked at, we wanted to understand, of those who identify as Māori in their self-identified ethnicity information, so the 2018 census, who was also identified as Māori in corrections data. And so this is corrections data 2018 to 2021, so not dissimilar time period. And here we were able to look at matching, so was their ethnicity matched? And we found, again, if you look at the bottom, 88% had this, so 88% were Māori on both data sets, and that's 88% of people who identified as self-identified as Māori in the census were also identified as Māori in corrections. But we also found that there was so there was a few people who were identified as Māori in the corrections data and not as Māori on the census. So the overall net undercount was 6%, but the total undercount was 12%. So 12% of people, which is obviously the inverse of that 88%, were identified as Māori on the census data and not in corrections. So and again, it varied a little bit by age and gender and imprisonment type, but we found that really consistent pattern. So the data that corrections is producing is undercounting Māori, which is the bottom line of that, and we've submitted that paper for publication.
So just to finish up, we just wanted to sort of highlight that for us, it's more the lived experiences and the dreams and the priorities of the whānau that we work alongside, that determines the priorities for this project rather than our own assumptions about what whānau and communities need in this space. And as I've said, the way we work alongside mahi, alongside whānau, the way we engage with data about whānau, about how we think about the data that we're using, is of equal importance. And also one of our key points, especially with this paper, is that in our argument for high quality, timely ethnicity data for Māori, we're not suggesting expansion of data collection or additional surveillance. It's more that we're highlighting that government must meet fundamental obligations under Te Tiriti to record basic demographic data accurately and reliably. Yeah, kia ora.
Yeah, so I wonder how much of this is driven by the multiple reporting and the personal details versus the single reporting and justice. And what might show this up is if you look at the other ethnicities as well. So was European undercounted? Was Pacific undercounted? Those were the two I'd probably pick on there. Was Asian undercounted?
So we haven't looked. We have looked at that, but we haven't looked at it in detail. I don't have it on the top of my head, unfortunately. We need Frederika here who did that work. Yeah, so I think you're right. I think that that it is partly that it's a preferred ethnicity and it's not a Māori prioritised ethnicity. So
the preferred ethnicity is pretty much a made-up category. Like it doesn't follow any. One of the main driver is that the corrections does not adhere to ethnicity data protocols, and they've they admit to that. That's not unknown, and so that category is a totally made up category, which means that it's made up for everyone. But in saying that, the older data comes from the justice law enforcement system, so that which was police officers like ascribed ethnicity of somebody, so and that's more likely to have an impact on Māori compared to like others, or probably Pacific peoples as well though, but so that sort of historically the evidence shows it that the ascribed ethnicity impacts on certain groups more than others. So it's just that it was worse for Māori, but we didn't look at Pacific peoples in specifically, mainly because our focus was on Māori for this.
Yeah, and I think that the point is, as Paula says, they need to use proper methods for collecting ethnicity data, and that means not having preferred ethnicity, however they're establishing that, but actually having ethnicity information that allows people to be properly counted. So I think, yeah. And I guess, yeah, and picking up on Janet's question around one ethnicity per person. So no, as Barry says, there are, people can have multiple ethnic identities within the personal details table. And so we looked specifically at everyone who identified as Māori, whether or not they identified with the other groups as well. And so, yes, so that is partly what's driving this difference, but of course that means that people who are Māori are not being counted and not reported in that already vastly overrepresentation within the group who are incarcerated. So I think that, yes, you're right, this having multiple ethnic identities is part of the driver, but that means that we're missing people and that means that we need to do it better.
When you talk about the preferred ethnicity being made up?
The category's made up.
It's made up, but it is given by the person?
Yeah, well, whatever a person would interpret that as, yeah, they do. Well, it kind of depends. Like, I think there's a sort of a lack of transparency because we have asked those questions under an even sort of thing. So there's a bit of lack of transparency. What's not quite clear, how that's followed through. So it could still be ascribed regardless, or it could be reported.
Yeah, so it's not entirely clear how that's collected. It's fairly likely it's collected in lots of different ways. It's not at all clear that the word preferred is used in the way that it's collected, or whether that preferred is ascribed. So
yeah, because if
we tried to find out.
Non-adherence to the ethnicity data protocols kind of means that there's non-adherence to every single way of collecting it as well, not just the actual thing. So that's why, and it was all sort of a bit wishy-washy in terms of what the OAA response was.
But as Paula says, it is a recognised area of needed improvement by corrections and justice.
Yeah, improving ethnicity data was in the action plan, but that's probably as far as it's gone. From it's a bit hard to see what work's been going into it, to be honest. Yeah.
And I guess the wider point around caution when using ethnicity data from different sources. I mean, I think we're starting to have a better understanding in health around the limitations of the quality of the data that we have. But when we go into other data sets like corrections data set, it's likely that the quality of ethnicity data is even more problematic, and just going into those data sets with your eyes open around that and really questioning the quality of the data that you're looking at, I think is important.
Yeah. And I think one of the things that kind of, in terms of Maggie Walter, who I talked about earlier on, there's kind of that paradox where Māori are sort of hyper visible due to sort of racialized surveillance in society more general, but then are invisibilized once they're in a state institution. So we've got no way to fully understand the harms to Māori with regards to, you know, what the state's doing. And this isn't just really for prisons, it's like youth justice residences or care and protection, all of those areas. So it kind of throws up, I guess it really highlights that paradox. The other thing as well, maybe we don't need to go there, but I was just thinking about how, there's the issue around the administrative population census, and we've really highlighted that the data is pretty poor.
Yeah.
So it really, it does kind of highlight how is that going to be a useful way of or useful alternative to the census if the data quality is excessively poor. Just raises those questions. They've probably been raised before.
Elaine Thompson, Maori concepts of time not being linear. Can you elaborate on this?
It's a whole paper, but we have written one, so we can send it to you if you want, Lee. So we're kind of like, so the sort of colonial capitalist kind of productivity related aspects of linearity of time is not something that Māori, that was never our ways of knowing or being or doing and relating. So for us, there's no kind of there's no linearity. It's sort of, our time is kind of, can be whakapapa based. It can be like relational. It's past, present, future is all at the same point, same point. So there's those different concepts, and that kind of comes from the tauranga Māori, our knowledges and things.
Cool. And then just a plug that we have got the results of this research we're now writing them up, so there is more coming, and look out for it, I guess. And we did also publish a paper on mortality after release from incarceration, which used this IDI data as well, which was our kind of first piece of work in this area, which is also available, and the data quality one is on its way.